Wound Rounds has made a big impact on our program here. It has enabled us to be better on top of the wounds that we have, to anticipate the progress of the resident and to communicate better with our staff and our physicians, as well as the families and the residents, as to how the progress is going with the patient's wounds. One of the benefits of this program is that each week we try to send out a weekly report to each of the physicians that enables them to have a better understanding of how the progress is with the wound, where they will get a picture as well as documentation on the progress of the wound, so that they will be on top of what is happening, not just a phone call, but actual a picture where they can see the progress, where they can see how it was 2-3 weeks ago as well as how it is this week. And that's enabled us to have better communication with the doctor to be better on top of the treatments of the patient, and to help us to better heal the wounds. We work with hospitals' wound clinics, and we are able to better communicate with them the progress of the wound also, where we will send them regular updates on how it's going and how the progress is going, so that they can then make better recommendations on changes to the treatment. They work with the hyperbaric chamber there and other programs there, and we're able to better stay on top of and be more quick to respond to changes in treatments. Wound Rounds has enabled us to better communicate with all of the staff here. Any nurse can sit down and look in and see the progress that has been made, or lack of progress that has been made maybe in some cases, so that they can then communicate with our treatment nurse and the physicians and the residents and the families to better stay on top of everything. And that's really helped us a lot. Wound Rounds has helped us to stay better on top of our wounds, and has really helped us to cut down on some of our expenses and our costs, so that the treatment nurse can spend more time doing treatments and document right there at bedside, so that they can then stay on top of everything and be more attuned to the needs of the resident. It saves us in time, money, effort, to be more efficient with what we're doing and to better communicate to the director of nurses, myself, the administrator, and the physicians and residents and families up and down the proverbial ladder, and the programs that are going and how they're progressing. Wound Rounds documentation process has really benefited us with our surveys. When the surveyors come in and hear that we're using Wound Rounds, they're impressed with the ability to be able to share information and to see what's going on with it. And we haven't had any issues with that because of the systems that we put into place and that Wound Rounds has to enable us to do a better job of communicating and sharing information. Wound Rounds has improved the job satisfaction amongst a number of different staff. We have one treatment nurse who does the majority of the treatments and the majority of documentation, but there are a couple of people who fill in when he has time off or when he is off on a specific day. And they all have enjoyed the things that Wound Rounds can help us with. It enables us to have more continuity regardless of who's doing it, and to be more efficient with the time that's utilized, so that they can come in, do their treatments, do their documentation, and then go on, where they don't have to spend more time or more effort to do less work. I don't know that I could say that Wound Rounds has one specific benefit to us. There are a number of different benefits. The ability to be able to see the progress of a wound. So we can see weekly, is the Braden score getting better or worse? Is the push score getting better or worse? And that enables us to better stay on top of it and to watch, is this person being turned and repositioned? Are they on the right nutritional things? And is the treatment something that is being monitored weekly so that we can change it? And that's what Wound Rounds has enabled us, to save money, to save time, and to better treat the residents' needs.